Welcome, 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 welcome to the Lamp and Light Fellowship of Nurses. I pray that y'all are having a blessed week. Coming back to you with another video. Just to give you a little background on myself, my name is Fran or Nurse Fran. I am a tutor for nursing students. I tutor in the subjects of Med-surg, fundamentals, and also pharmacology. So if you do need one-on-one tutoring session, you can go to the website www.lampandlightnurses.com and book your session under the services tab. Also, I have been a nurse practitioner for the last 11 years and I have graduated nursing school back in 2008. So enough about myself. If you have tuned into the video, it's because you want some study tips on how to pass your test, and not just on nursing school, but just in general. So these are just like general test taking tips, or study tips rather, to help you. So it doesn't matter what test it comes to, whether it's a test for Med-surg or whether it is your NCLEX or whether it's your GRE. It's just general study tips to help you be successful in your studies. So as I go over some of these study tips, you might be saying to yourself, look, like some of this stuff is elementary, or I already know this. But just because you know something, that does not mean that it should not be repeated. So if you already know it and I'm repeating it, that's probably because it's something that you should really pay attention to. It's very helpful, right? So the first one is to record your lectures. Now, this is if you're allowed to do so, because every nursing instructor or every instructor in college or universities, they don't allow you to record their sessions, right? They don't want your phone out during lecture time. So if they do allow you to record the lecture, record it. And not only do you record it, but when you get in the car, just start to listen to it, as soon as you leave, right? Because that way you can keep it fresh on your mind. So listen to it. And also, when you go back and listen, you may have questions. She may have said something, or he may have said something during the lecture, and you may have, it's not lining up maybe with what's in your textbook, or it's not clear to you. So that way, when you record it, you can go back if you have questions and you can get clarification. So that was the first tip, study tip, is to record the lectures. And of course, that's if you allow. Number 2, don't wait until the last minute to study. Let me say that again. Do not wait until the last minute to study. Cramming is not good. That's why it's good, like day after day, you should set aside study time for yourself, uninterrupted study time, so you can study. Because some of this stuff, y'all, you cannot just remember something just so important and think you're going to grasp the concept of it in one night, and then you think you're going to go and take the test and ace the test. That may have worked in elementary school, but now that you're in nursing school, that's not going to work. So sometimes, in nursing school, every question that you may get is simply not a recall question. It's simply not a simple value. Let's say an example. Your instructor may ask you what's the normal value for potassium. You'd be like, okay, that's between 3.5 to 5, and that's one of your answer questions. No, it's not going to be like that. It's going to be about comprehension. So now that you know that that is the normal for potassium, what things should you look out for, right? They may come and tell you, okay, a patient has a potassium level of such and such. Which medication should you hold, or what is contraindicated? Or they may give you signs and symptoms of a patient's illness or presentation, and they might ask you, well, based on the lab values, what should you expect? So don't wait until the last minute to cram, y'all. Don't wait until the last minute to study and thinking you're going to cram. And definitely, if you're preparing to take your NCLEX exam, cramming is not going to help you at all, because the NCLEX, they're not worried about you recalling information. They're worrying about, can you apply what you have learned, right? Because they want to make sure that you are safe. So the test questions that you take on the NCLEX is going to be in a whole nother arena. It's not going to be like your Med-surg questions. They're going to be amped up, right? So it's not good to cram. Pace yourself when you study and set aside time for your study time. Don't wait until the last minute. And number 3, don't study when you laying in the bed, especially if you have a pillow top mattress and that mattress is so soft and so cushiony, and you done came home from clinicals, your feet are hurting, and all you want to do is lay down, right? And as soon as you lay down on top of that good feeling mattress, the next thing you know, you have dozed off. And a nap of 15, what you thought was going to be a 15-minute nap, then turned into a 3-hour nap, right? Or you may have missed the deadline because you were studying all in the bed. Get out the bed, right? Do not be laying in that bed and calling yourself studying, right? Because next thing you know, you're going to be sleeping. So get out of the bed. Remove yourself from the bedroom and go into another area in your house where you can study. Go somewhere where it's well lit, where there are no distractions. Go somewhere where there is no TV beside you, right? Go somewhere where there is no remote control beside you. And if you're tempted to watch TV, remove the remote, right? So don't study while you're laying down in the bed. Get up and leave your bedroom. Let your bedroom just be for sleeping, right? Or just let it be for sleeping and whatever else you got going on. But don't let it be to the place where you study. Call yourself studying, right? So leave the bedroom. And I just said tip number 4. Make sure you're studying in a well-lit area. Make sure you have some good lighting, right? I mean, some of the stuff I already said, it was probably going to seem elementary to you, but a good lighting, it goes a long way. Make sure you're in well-lit areas, nowhere where the ambiance is like when you go into a fine dining restaurant and when you walk in there, you're just so relaxed, and you want to be where it's well-lit, y'all. Put you in the mood or the mindset. Look, I'm going into this to study. I want to make sure I make the most of my study time. Also, tip number 5, you want to set a time for study. Time that is uninterrupted. So you're going to make yourself a time block in which you can study and try to stick to it. Try to make it consistent where you do it around the same time every day. Because most of the times when we repeat something day after day and at the same time, it becomes a habit. So get into the habit of setting aside time for you to study, preferably like an hour or 2 or whatever you need. And if you have to take a break, you just let it be for you to take a bathroom break or to get up and stretch your legs out. But don't let that break be no more than, I would say, 10 minutes, because likely if it gets to be beyond 10 minutes, you're going to just probably forget. I ain't going to say you're going to really forget what you studied, but your mind is going to be on other things, right? So, and during that break, I think it's good to say this, but when you're taking a break, limit your break to 10 minutes, but also during your break time, don't get on social media. Because the next thing you know, when you on social media, what you intended to be 10 minutes, it didn't turn into a whole 60 minutes. You thought you were just going to get in there and look at so-and-so or look and see what so-and-so got going on. And that 10 minutes, y'all, has turned into a whole 60 minutes. So beware of distractions. Just know that sometimes social media is more of a distraction more than anything. So when you do take your break, please, I mean, this is just my opinion, but don't get on social media. Let it be to use the bathroom, or maybe you want to get you a drink of water. And when the time is off, I mean, when you finish studying, then you should get into, maybe you can get on social media then. And that wasn't on the list, so this is going to be a bonus. Since we're talking about designated studying time, when you get on social media, limit the amount of time that you are on social media. First of all, you can be on there too long, and then you'll start to covet and you start to get jealous sometimes, or people put stuff on Facebook, but everything that people put on Facebook and Instagram is not always true, y'all. So you're sitting here looking at somebody else's story and wishing you could have the life that they have, or wishing that you were an RN who made $300,000 a year. But I can guarantee you, coming out of nursing school, you're not going to be making $300,000 a year. And you can probably work 50 years as an RN and you would not come anywhere near making $300,000 a year. So don't believe the hype that is on social media. Don't let social media become a god. Limit your time on social media, because if you're on social media too much, you may start comparing your life to what other people have got going on, and then you may start to covet, or you may start to feel a little jealous, or you may feel like, look, I'm not enough, or I'm not good enough, or I'll never measure up. Don't do that. Don't fall into the social media trap. Next tip, which I've already said it, but when you study, and turn off the TV. Turn off the TV. Do not, and if you can, just be in a room where there is no TV, so you won't be tempted to turn the TV on, because TV can be a distraction. It's a television. It is telling you a vision of what they want you to believe. So when you are studying, you shouldn't be trying to study while the TV is on. Turn that TV off, or go into another room where there is no television, right? Okay. Study tip now is number 8. So this one right here would be your textbook. Your textbook is your primary source for information. Not what you saw happen in clinicals, right? Or not what you saw another nurse do while you were at the hospital. Because sometimes nurses can be in the nursing field for so long that they adopt bad habits. And sometimes even while you are a student, you'll see them engaging in this bad habit, or they'll pass this bad habit on to you knowingly. And one thing that you see in the real world, now, so there's a textbook world and also a real world. For testing purposes and passing your NCLEX, the textbook world is the world that you go by. And sometimes, like in a hospital, you may see a nurse give an IV push medication in probably under 30 seconds. When you were in nursing school, you were told to give it over, I believe, 2 minutes, and make sure that you time it. So make sure you're timing your IV pushes. And just that's the thing that you want to make sure you're doing. Because I just said that to say that some things that you see in the real world is not the textbook world. So your textbook is always your primary source of information. Your textbook, think about your textbook as always being what's right, no matter what you see going on inside the hospital, right? Textbook is always your primary source, and consider that primary source as the reliable source, because the things that are in your textbook have been verified, right? And last, I'm going to wrap it up with this. Ask questions. I cannot stress to you the importance of asking questions. And don't feel like questions, look, I don't want to ask that question because I'm going to be embarrassed, or that's going to be a dumb question. Look at my eyes, okay? No such thing as a dumb question, because the question that you may be feeling is dumb, somebody else may have that exact same question. So if you have a question, ask it. If you want to know, ask. And not only that, y'all, you are paying your tuition. You are paying your money. So you have a right, especially if school is what, $8,000 or more a semester, you better ask some questions. And they should have an answer. You know what I'm saying? So if you got a question, ask. So again, no question should be considered a dumb question. Or if you feel like you're going to be embarrassed, like when the class is over, pull your instructor to the side and ask them that you have, look, I have a question. This wasn't clarified. And they'd be like, after they talk to you, they'd be like, you know what? You're right. So somebody else may have this exact same concern as you do. So your questions are valid. If you want to know, ask. Because more than anything, y'all, you want to be safe. You want to demonstrate, because you want your nursing license. So when you go to take your NCLEX, they don't care about a lot of stuff that you got going on. What they want to know is that you are safe as a beginning level nurse, that you are competent, and that you can deliver safe patient care. Before you get your license, you have got to demonstrate that you can exercise safe, quality, evidence-based patient care. So these have been the study tips for you. And again, like, I'm Lord willing, I may come back and add something else to this. But that's it for right now. So if you have a question, any type of question, if you have a question about the tutoring sessions, you can reach me at info@lampandlightnurses.com. If you want to book a session, you can do so at www.lampandlightnurses.com. Now, what I do want y'all to know is that this journey, even though sometimes it can be hard, y'all, it's doable. You're looking at somebody who had to repeat more than one class in nursing school, right? So don't feel like just because you may have failed one exam or you may have failed a level that's it. It's not it for you. You know what I'm saying? Don't that one test failure don't let that make you feel like you are a failure. So this is possible. Always remember your why. And know also that with Christ or with Yeshua, you can do all things through Yeshua who strengthens you, right? And if you have any type of question, make sure that you're asking questions. But there is nothing that is too impossible. If you're having difficulty, just ask the Lord to give you strength to make it through this trying time. And indeed, He will give you what you need, right? But you got to make sure that you're in relationship and fellowship with Him by obeying His word. And I hope that this study tip has blessed you in any type of way. If you're not subscribed to the channel, please make sure that you subscribe. And also, please follow on Facebook at Lamp and Light Fellowship of Nurses. And y'all have a blessed day. Bye.